Today, we're talking about a topic getting so much attention right now: hormone replacement therapy and whether it might be right for you. Joining us are Dr. Khurana, a board-certified physician with more than 15 years of clinical experience, and Dr. Stanislav Sazonov from Medisol Pharmacy. I'm so excited to have you guys here. This is such a huge story right now.
That's right.
HRT has exploded in popularity, and in many cases that means your physician and your pharmacist working hand in hand. First, I want to start with you as a physician who's been in this area for more than 15 years. Tell me about the explosion in popularity of HRT right now.
So I think we have a lot more research now. People are becoming more confident. We have more availability of some of these resources. Once we do a good, thorough, comprehensive evaluation, we have a lot more people coming up and asking for these symptoms, some evaluation, and then treatment plan.
What are the symptoms, most common symptoms that people come to you for?
Most commonly, I will see perimenopausal women coming up to me saying, I'm feeling very tired. Whatever I do, I just feel very off. I can't sleep well. I have poor energy, or I'm having mood swings. Is it me? Is it my head? So we do a thorough, full clinical assessment and an evaluation, and sometimes their hormones may be depleted or they're declining, and that's when hormone replacement therapy is very helpful.
Well, I mentioned it was popular. These estrogen patches, this is making national news. They are sold out. There's a patch that you change, I think, twice a week. You can find that at some pharmacies, but the once-a-week patch is sold out. One thing that I love about a compounding pharmacy, and I love this about Medisol, you guys make your own. So if you can't get a patch, what are some of the other ways to get the hormones?
Yes, so that's where compounding pharmacy comes in to help fill in the gap. Anytime there's a drug shortage, we can compound either topical cream, gel, we can make into capsules or troches that you can dissolve under the tongue. Any formulation that's patient-friendly that your physician would want you to have based on your needs.
And I think you'd both agree, when you're talking about HRT, you get blood tested frequently, and you frequently need to make adjustments, so you're working with physicians all the time.
Yes, and one thing I love about working with Dr. Khurana is that her philosophy of patient care kind of aligns with Medisol Pharmacy. She takes time to go over patient needs, make sure that they're addressed. She's not rushing, and that's what we do at Medisol. We try to understand the patient as a whole, try to address all of their concerns and their needs, and run all of their medications to make sure that it's compatible and safe. And having that open line of communication where the left hand knows what the right hand is doing is very important, and it reduces the frustration for the patients and makes the healthcare more streamlined.
I want to talk about how much it improves the lifestyle of women who are taking HRT. In your experience, whether it's the patch, the cream, sublingual, how does it treat their symptoms and change their lives?
Absolutely. So a lot of these women will actually start to feel better within a few days of replacement.
Wow.
And it's pretty instant. You'll feel better, you'll have more energy, they're able to sleep better, their mood's better, the brain fog clears up. And if there's any underlying thyroid issue or insulin hormone or any other hormone that needs to be tested and evaluated and treated, we provide that wholesome care. So obviously they will feel immediately better from all of these.
That's
symptoms.
incredible. Within just a couple of days. I mean, there's a reason these patches are sold out. You two are working together to do an event, and if any of our viewers are curious about HRT and want to learn more, tell us about this event.
Yeah, so we'll be hosting a talk on, or seminar on bioidentical hormone replacement therapy as an educational event and free event to our community, because we want to give back to our community. We want to show that we're there for them, and it will be on March 26th. It's completely free to the community. You have to RSVP to info@medisolpharmacy.com, and dinner will be provided. It's on Thursday between 6 p.m. and 8 p.m.
What a fantastic idea. It's a free event. You get dinner, learn more about HRT from a physician who's been in that arena for a long time, and from one of the most respected pharmacists in the Valley. Thank you guys so much for being here. We're going to put this information up on our website, CW7AZ.com. Thank you so much.
Thank you.